Hey guys, what's up? I'm going to talk to you about schizophrenia today for our Gen Psych project on psychological disorders. Schizophrenia is a group of severe disorders characterized by disorganized and delusional thinking. Schizophrenia literally means split mind, where your mind is split into two different sections. Jumping from one idea to another may occur even within sentences, creating a sort of word salad, as they say. Many psychologists believe disorganized thoughts result from a breakdown in selective attention. In schizophrenia, there are three subtypes. They are paranoid, disorganized, catatonic, undifferentiated, and residual. Patients with positive symptoms may have hallucinations and are often disorganized and deluded in their talk. They also may exhibit inappropriate laughter, tears, and rage, such as laughing when it's in church or a funeral and crying when it's supposed to be happy. They can't distinguish between two different emotions. Patients with negative symptoms have toneless voices, expressionless faces, or mute and rigid bodies. Positive symptoms are the presence of inappropriate behaviors, and negative symptoms are the absence of appropriate. The four subtypes, paranoid, disorganized, catatonic, and residual, all kind of have to do with different types of delusions and hallucinations. I'm going to focus on catatonic today. Catatonic has to do with immobility or excessive purposeless movement, such as wavy flexibility in which people place or allow their limbs to just go everywhere. They don't have control of hands and arms and legs, so they don't know what's going on. But it also deals with extreme negativism, and people with catatonic schizophrenia are negative almost all the time and repeat other speech when they are being talked to. Yeah, thanks.
I'm Stephanie, and the term clinical depression is merely an episode of depression that is serious enough to require treatment. Major depression, on the other hand, is marked by much more severe symptoms, such as being unable to drag yourself out of bed. Another form of depression is known as seasonal affective disorder, and it's associated with seasonal changes, and it deals with the amount of daylight hours. Major depressive disorder is like the common cold of psychological disorders. It's also the number one reason that people seek mental health care. It's often a response to past or current losses, and the person, for no apparent reason, generally experiences 2 or more weeks of depressive moods, feelings of worthlessness, and diminished interest. Also, some of the other symptoms are prolonged sadness or unexplained crying spells, insignificant changes in sleep patterns or appetites, irritability, anger, worry, agitation, anxiety, pessimism, and indifference, feelings of guilt or worthlessness, and pleasurable inability to take pleasure in former interests and social withdrawal, reoccurring thoughts of deaths or suicide. And when it really becomes a problem is when a person experiences these for 2 weeks or more, and the symptoms begin to interfere with family activities or work. Some of the different kinds of treatments for cognitive, some of the different kinds of treatment for major depressive are cognitive or behavioral therapy and interpersonal therapy. And a lot of times family plays a major part in helping somebody recover from depression. Bright lights can help people with seasonal affective disorder. There's also 3 different main types of medications that can be used. Tricyclics, selective serotonin reuptake inhibitors, or SSRIs, or monoamine oxidase inhibitors, or MAOI inhibitors. Also, sometimes elective convulsive therapy is used. This uses small amounts of electricity applied to your scalp, which affects your neurotransmitters. It's highly controversial at the moment, but can be potentially life-saving technique. and it's only really considered when other techniques have failed, or when a person is seriously mentally ill or unable to take medication, or in some cases, when a person is likely to commit suicide.
Alright, well hi, my name is D.A. and today I'm going to be talking to you about dissociative identity disorder. Dissociative identity disorder, which is also called DID, is defined where a person has two distinct different personalities pining for control over the person's body and behavior. Well, we're going to be talking about Kenneth Belanchi. Belanchi was this guy in California, and he strangled and killed 10 women in California, and he was on trial for this. And during one of the hypnosis sessions that he went through, it came up that he had another personality named Steve. Steve was the bad one, and he claimed that Steve was the one who killed and murdered all of those women, and Kenneth was actually innocent. But it turned out that Kenneth was a good liar and had read about DID before his trial and had tried to come up with that. But DID is really a more extreme version of what we go through. For instance, I'm calm around my parents, but I'm rather not calm around my friends. It's just taking that action to an extreme. There are usually three different views of this disorder. The first one is that it is an actual disorder, there are different distinct body and brain states that correlate to the different personalities, and in some cases, handedness will switch with one personality to another. One personality is right-handed and the other one is left. Also, memories from one personality to another will not always transfer. So one personality can do something and the other wouldn't know. The second view is that are those of skeptics, that it's not really a disorder, it's something that we've made up in our minds. The reasons being that in the 20th century, this has absolutely boomed. It's exploded from 2 cases per decade to 20,000 per decade. It's also just a cultural phenomenon. In Japan and India, there are virtually no cases of DID. Also, some would make the case that the psychologists in their questioning kind of force another personality to come out of the person. The third view is that it's a kind of traumatic disorder, that it's the body's way of protecting itself. Some people in childhood abuse situations, they just pull themselves in and they try not to deal with everything that's going on, and that's their way of the one personality, closing in on itself and letting another one take over. The other example is a friend of mine, but for safety's sake, I'm going to use Bill and Bob as his 2 identity names, so that I don't give away who it is. Bill, one of my good friends, has dissociative identity disorder. Just recently, actually, within the past 2 weeks, he turned into Bob. The interesting part about this is that Bill and Bob both have full knowledge of each other. That's something that the textbook doesn't really talk about. But Bob was talking all the time about Bill and how he didn't like Bill and what Bill did, and had full knowledge of all of the actions, all of the memories, had access to everything that Bill had access to. which is very interesting, and it really doesn't talk anything about this in the textbook. My personal theory on this is that Bill had previously gone to counseling, and through hypnosis, he had become aware of the situation and that he had DID, and you know, this kind of showed him that Bob existed, and that, you know, and when Bob was in control, it showed Bob that Bill was in existence, and therefore kind of showed each other that they were there.